Semen analysis is a basic yet important test to understand the male's fertility profile. Now, how do we do a semen analysis? We usually recommend that the patient has at least 3 to 5 days of abstinence before producing a semen sample. And the best way of giving a sample is by masturbation. In a fertility clinic, a private space is allocated to the patient to give a sample. The lab personnel hands over a sterile plastic container that is previously labeled with the patient's name, a unique hospital ID and the date of collection. The patient is given all the time he needs to collect the sample at his own will. Once the sample collection is done, the patient deposits the sample in a destined area which is left alone for a period of time before it is being processed. One thing which we will have to understand as a part of the semen collection process is that to ensure there is no spillage of the sample during collection, and it is necessary also to understand not to touch the inner aspects of the bottle to prevent any kind of contamination. If you have any issues collecting the semen sample, please be vocal about it to the person who is in the lab so that it can be effectively handled. For people who are still uncomfortable giving a sample in a fertility clinic, home collection can also be provided. But again, as far as home collection is concerned, it has to be ensured that the sample is collected properly and is reaching the lab within a reasonable time frame of around 45 minutes to 1 hour. Certain people also prefer collecting sample by intercourse. In such cases, it is necessary to ensure that we use non-lubricated condoms for collection. Once the intercourse process is over, the condom can be handed over to the lab personnel and the sample is then processed from there.